Hey guys, welcome. We're glad to have you join us for our second session of the day. This is our NCLEX challenge. We are going to look at one very high-level NCLEX question together. We're going to talk about the right and wrong answers and the rationales behind everything. We're also going to find the content, so that way we can talk deeply about that as well. My name is Ashley. Everybody calls me AG, and I'm going to be with you for this session. All right, so just in case you were not with us for session number one, let's just start off with just a little bit of information about the NCLEX first before we go into today's question. Okay, so first, what do you need to know before you go into the NCLEX and take it? Well, if you don't pass on your first attempt, then your odds of passing have automatically declined. Now, again, this is not because they make the test more difficult for repeat test taking students. This is simply due to the fact that you've been out of nursing school for an extended period of time. You've not been exposed to the lessons and the content. You are not constantly exposed to practice questions or scenarios that happen at clinical at the bedside. So if you wait longer than 3 months post-graduation to take and pass your NCLEX, then that's going to affect your score. That's why when you look at the data from the NCSBN, you can clearly see where there is a difference between the first-time test taker column and the repeat test taker column. Now, I don't want that to discourage you. You can definitely still pass the NCLEX. You just need to prep the right way. And so we love being able to help all test takers pass the NCLEX. Another thing that gets students messed up sometimes is that they view the NCLEX as an extension of what they've already been doing in nursing school, like just one more hoop to jump through. Well, yeah, you got to jump through the hoop and get your license, but it's not just an extension of nursing school. They're trying to see if you can move beyond what you've done in nursing school. Get out of that textbook and show them that you have developed good clinical judgment on your own. And so please do not expect the answers to the questions to come directly listed out of a textbook anywhere. You're going to have to use the content that you know to formulate good clinical judgments, and that is not listed in a book. So we're going to show you what that looks like, and we're going to practice that as well. And another thing that you need to know is that this test is all about safety. The goal is to keep the client safe and alive, to teach people the right way, to make sure that the students know what they're supposed to know, or the family, or another staff member. Or do you even know how to get out of scenarios by yourself? Sometimes there won't be a client. It'll just be you in a dangerous situation. And they want to know, will you get out of that situation safely, or will you expose yourself to some harmful chemical or drug? And so this is the reason why we have to make sure that we can use our content to make good clinical judgments. All right, friends, with that in mind, let's go into our question. Okay, so let me explain how this is going to work. We're going to put your question on the screen, give you some time to think about it. When you think you know your answer or answers, and in this situation, it's going to be an order. Okay, you're going to put these clients in the correct order. So that means you got to use all of them. When you know that correct order, I want you to use your chat or your comments and let me know in that chat or comments what the correct order is. Then I'm going to come back on and we're going to walk through the question together. So take a peek at this one and then we'll be back to discuss. All right. Okay, so I know you might need a little bit more time, and if you need that, you go ahead and take it. But what I want to go ahead and do is start pointing some things out. If you were with me in the prior session, I gave you some really good strategies in order to answer your questions appropriately. I told you that sometimes when you're looking at a question, your job is to fix the problem. Okay, well, in this situation, that's not our job. Okay, sometimes the situation is to pick the killer answer. Like, what's the thing that's going to make the client die first? That's not really this question either, but it's closer. This type of question is going to put the clients in the correct order that you would see them. And so in order for you to effectively do that, that makes this the type of question where you have to say, who's going to die first? Now, I know that there's a strategy that you've used in nursing school, and it helped you a lot in nursing school. But I'm going to tell you that it's not an effective strategy on the NCLEX, and that is ABC, airway, breathing, circulation. Why is that not an effective strategy on the NCLEX? Because the way that that worked in nursing school is typically when you said airway, breathing, circulation, you looked for an option where the airway was listed, and you picked it first, and you were probably most likely right. And then you looked for something that talked about breathing is next, and then circulation is next. And you were probably right when you did that. Okay, if there was no airway issue, then there was a breathing issue, and you picked it first, and it was right. Well, I'm going to tell you that on the NCLEX, do not be surprised. If you have a question that asks you a situation like this where you put the clients in the correct order, and one of those clients has an airway issue, and one of them has a breathing issue, and one of them has a circulation issue, and then maybe somebody's in pain. And you look and you go, oh, airway is first. And it will not always be first. It is dependent on what is happening with the airway. It is dependent on what is happening with the breathing or the circulation or anything else. There will be plenty of times where you put these not in A, B, C order because it's dependent on what they say. All right, remember, it's about what information they give you in the question. All right, so with that in mind, let's look at these options, and instead of just going blindly, airway, breathing, circulation, I want you to ask yourself, out of these four, who's going to die first if I don't do anything? Who do I absolutely have to go in the room first to keep them alive? If I look at it that way, it's going to be the client with Addison's, they're lethargic, and they gave me some vital signs. All right, why is that? Well, we've got to know our content in order to be able to figure that out. So let's go through this option and let's discuss what's happening here. Okay, first, they've got Addison's disease. That's important. When somebody has Addison's, they are deficient in all of their steroids. They don't have enough mineralocorticoids, glucocorticoids, or even the sex hormones. Okay, they are just deficient in absolutely everything. But the one that's most important for me to remember here is the mineralocorticoid, aldosterone. Okay, aldosterone's normal job is to make us retain sodium and water. Well, they don't have that because remember, they're deficient. So because they're deficient in the thing that would make them retain sodium and water, they lose sodium and water. This client's going to go into a fluid volume deficit, and they could start showing you signs and symptoms of shock. Okay, well, now that I know that, keep reading. They're lethargic. Well, of course they're lethargic. They don't have enough volume. And then look at those vital signs. Those are not random vital signs. These are vital signs that absolutely match my client going into shock from losing all of that sodium and water. When you have a client who's going into shock, the blood pressure drops and the pulse and respirations go up. Now, I don't have a set of baseline vitals to compare this to, so I'm just going to use what I know as normal. Okay, when I look at this blood pressure, that's scary. That is way less than 90/60. If I'm trying to figure out when do I panic, any blood pressure that is less than 90/60. If it's 90/60 or higher, that's still enough pressure for good perfusion. But the moment that it drops below that, and guys, it doesn't have to be both numbers. It can just be one of them. When it drops below that parameter, I need to panic. That's not enough pressure for good perfusion. And then look at that pulse rate. Okay, that is high, just like what would happen in shock. Remember, with the pulse in shock, it's trying to pump faster to get around what little bit of volume you have left, trying to perfuse the vital organs. And then the respirations are up too. That's too fast. Your body perceives a lack of volume as a lack of oxygen. It really can't tell the difference there. So your body's breathing faster to get more oxygen. Okay, so do you see? This client, they're going to die first if I don't go in the room right now. So instead of going airway, breathing, circulation, I have to pick this one first because this client is actively in shock. All right. Let's pretend that they're no longer an option because I took care of them. Now I only have 3 left. You do the same exact thing. Out of the 3 that we have left, who's going to die first? Okay, well, when I look at it now it's going to be the client with the airway issue. All right, so just because it says that my client is diagnosed with respiratory failure, that's not enough for me to put them first. Read why. Keep going. They're on a vent. If they're on a ventilator, that means that their airway is currently protected. Okay, but that's not all the information they gave us. Keep reading to figure out why they are priority number 2. Yeah, they're on a vent, but they require frequent sedation. Guys, that means if I don't keep going back in the room frequently to keep the client sedated, their airway will no longer be protected. So that puts them higher up on the list, but it does not make them number 1. Just because they have an issue with their airway does not automatically make them number 1 priority. You have to read each option and figure out who is in the most trouble right now. All right, so they are priority number 2. Okay, do the same thing. I've taken care of them. I've only got 2 people left. So I'm having to choose between the client that had a thyroidectomy or the client that has lung cancer. Now, I'm going to also tell you that just because something is wordy does not make it a high priority. Okay, because sometimes people try to use that bad strategy. And you also have to note that just because something is 2 days ago or 8 hours ago, the length of time does not make it a lower priority. You have to, again, figure out what's going on and assume the worst about it. So out of these 2, who would be the one that would die first? Okay, well, that's going to be the client with the lung cancer, iatrogenic Cushing's, and then they gave me an ABG. Let's talk about why. The first thing that I need to do is anytime that they give me values like labs, let's just figure out if they're normal. That's the reason why we gave you the normal lab values, because the NCLEX will give you the normal ranges for your labs if a number of a lab is listed anywhere in either the question, in the options, or the exhibit. If they give you a number for a lab, they have to give you the normal ranges. So we gave you the normal pH ranges and the ABG ranges here. Okay, so when I look at this, that pH is fine. The PaO2 is not an O2 sat. An O2 sat is an SaO2 or just a PO2. That would need to be 90 or higher. This is the partial pressure of oxygen located in the arterial blood. And that value can be anywhere between 80 to 100. So that means 88 is perfectly fine. The PaCO2 is good, and so is the bicarb. Guys, there's nothing wrong with this ABG. It's perfectly fine. Just because they give you the values doesn't automatically mean something's wrong with it. Okay, but let's keep going and let's figure out what is happening here. They have lung cancer, and then they have this thing called iatrogenic Cushing's. Now, Cushing's, I know you know. Cushing's is the exact opposite of Addison's. It is where they are too cushy. They have way too many of all of the steroids, too many mineralocorticoids, too many glucocorticoids, and too many sex hormones. All right, well, that means they're at a risk for fluid volume excess. Okay, well, the other issue is they got this word here that says iatrogenic. Anybody want to take a guess? Okay, let me know in the comments or the chat if you know what the word iatrogenic means. I'll give you just a second. And I'm going to give you a really big hint here. Do not get it mixed up with its cousin, idiopathic. Idiopathic means, I don't know, okay? Unknown cause or origin. Iatrogenic means, oh, I definitely know because I did it, right? It was caused by treatment. So we were doing something else completely, not dealing with this, and we ended up causing another problem. So the problem we caused was Cushing's. How did the client end up with Cushing's? We were treating their lung cancer. Steroids are one of the most typical things that we will utilize in the treatment of someone that has cancer of any kind. And if if the body metabolizes those steroids in a different way, because everybody's body is different, they may have metabolized those steroids way too much, and the client ended up with way too many steroids in their body. So we were treating their lung cancer with steroids and ended up causing them to get Cushing's. That is why it's iatrogenic. But guys, we know exactly why it happened. They have lung cancer with no other issues, and their ABG is perfectly fine. That makes them lower on the list. That's the reason why they're number 3. Okay, now, why is the second option the last one? Because they're the most stable client out of the 4 that they gave you. And please remember, they're not the most stable because this procedure was 2 days ago. The length of time has nothing to do with it. They gave us more information in the question to let us know why they are the most stable. What do I mean? Okay, well, the client had a thyroidectomy, but they have a negative Trousseau sign. Okay, let's discuss that. A thyroidectomy is where they go in and they intentionally remove a portion or the entire thyroid. Okay, well, the problem is not the thyroid. The problem is the parathyroids, because the parathyroids are very small and in very close proximity. So it's a chance when they go in to remove the thyroid that they accidentally removed some of the parathyroids. The parathyroids are all about calcium. And the Trousseau sign is one of those signs that you see with calcium. Well, if the parathyroids are about calcium, if you remove some of those, your client will show you signs and symptoms of hypocalcemia. Calcium acts like a sedative. So that means if the calcium is not where it needs to be, instead of being sedated, you will be not sedated. That's going to mean you're going to show signs of hyperirritability, muscle tension, things like stridor or laryngospasm, irritability. So the Trousseau's is where you put on the blood pressure cuff. You pump it up. And what would happen is if the client had a positive Trousseau's, which is not good, by the way, the client's hand would tremor or contract. That shows you signs of hyperirritability, which is not good. But this client had a negative Trousseau's. That means when you pumped up the blood pressure cuff, nothing happened. The hand just stayed still, which is a great sign. That means that the client's calcium level is intact. So this client had a thyroidectomy 2 days ago, and they do not have a Trousseau's. They have a negative Trousseau sign, which means stability. This client is the most stable client that you have. That makes them the lowest on the list when it comes to priority. So if you were filling in the blanks here, you would put 2, 4, 1, and 3. All right, guys, you see how that works? Okay, before we finish with this section, let me give you one more really good piece of advice. Let's talk about glucocorticoids. If you know what glucocorticoids do, because they have 4 major actions, if you know what they do, you can answer just about any question about steroids. What do I mean? Okay, well, if I know that number 1, when somebody takes a steroid, it changes their mood, I can use that on the NCLEX. Hey, you already know this, but when somebody takes a steroid, sometimes they get that wow burst of energy, right? Where they can clean their entire house in 30 minutes and they can't sleep. Or they get hypersomnia where they can't wake up. They sleep all the time. Some people get really mean. They say things that they would never say before. Well, how do I use this on the NCLEX? What if you have a client that has a mental health disorder and they're going to take some steroids? I would want to watch them a lot more carefully for things like enhanced mood or depressed mood. Suicide could be at a much higher possibility during this time. I can use that on the NCLEX. Okay, so you see how knowing that helps? Yeah. Okay. The next thing that I need to watch for, other than changing their mood, is that I need to know that when they take a steroid, it will alter their defense mechanism. Okay, what does that mean? You're at risk for infection. Yeah, I've lowered your immune response, but now I've put you at a high risk for infection. So when somebody takes a steroid, infection, how does that help me? Room assignments. I'm never going to pick the client with an active infection and put them in the same room with somebody who's taking a steroid. Because if I do, the client taking the steroid is going to get that infection for sure. I just made a really bad room assignment. I can use that on the NCLEX because you know they love asking you about making room assignments. Yep. All right. The third thing is that when you take a steroid, it inhibits your insulin, meaning that your glucose is going to go up. This client may need to take insulin to regulate their glucose now. This is the reason why we always do AccuCheck monitoring or glucose monitoring when the client is in the hospital or facility. They may need some insulin. I can use that on the NCLEX for sure. And then the last thing is that when you take steroids, it makes you break down your fat and your protein. You already know what I mean. Have you seen someone who has Cushing's, or maybe someone who took a long-term regimen of steroids? They get the skinnier arms and legs, but maybe a moon face, a buffalo hump, protruding abdomen. Yeah, that's a redistribution of that fat because it's been broken down and then redistributed. I can use good client teaching here. What if it's a kid who has to take long-term steroid therapy? I can teach the family, hey, you want to watch for this. Because then they don't panic when they start to notice that that child's arms get skinny, but they have a moon face, right? Good client teaching decreases anxiety. You always want to be able to effectively teach, so that way your clients stay calm. I can use that for sure. If you know those 4 things, imagine all the questions that you can answer. If they ask me anything about steroids, I know what they do. I can answer those. All right, now another strategy here is remember to think like a brand new nurse on the NCLEX. Okay, thinking like a brand new nurse will always help you. So, what does it mean to think like a brand new nurse? Okay, well, number 1 is that you need to think NCLEXy. NCLEXy thinking involves 3 things. Number 1, assuming the worst. Okay, remember, when they give you a situation, it's never not that bad. It's always that bad. Assume the worst about the situation at hand. Number 2, fix the problem. Remember, your goal is to fix the issues that the client has, not to gather more information, but to fix it. And then 3, think safety. That's why we told you things like you need to make sure that you pick the killer answer or pick the client that would die first, because you're trying to keep people safe and alive. All right, so if you keep this in mind, those strategies work 100% of the time on the NCLEX, no matter what question you get. All right, now let's talk about your free events. What you're in right now is considered to be a free event, and we love for you guys to join us for more free events in the future. Now, the point of registering for these free events is that way you are eligible for a QBank. So to show you the list of free events that we have and make you be eligible for those by registering, we've got the QR code up here. You can scan that QR code, save the website that it brings you to, and then you can register for any free events that we have in the future. We also have the website listed down at the bottom of this little screen. It might be too hard for you to see, so I'm going to tell you what it is. It is hurstreview.com/free-events. That will also take you to the same website. You can bookmark that if you want to register for any other future events that we have. All right, let me get you guys the discount code again for today. Just a reminder, if you were not here with us for that first event and you did not get this code, please make sure that you either write it down, take a picture, or screenshot this screen so that way you can always have this. This code is good for the entire year. Okay, so even if we don't have an active promotion, you've got a discount code that you can use any day from now until the very end of the year. All right, as a thank you guys for joining us, we love to give away QBanks, and I've got a winner for this session's QBank. IT has randomly selected, and again, I always apologize in case I mispronounce anybody's name, but Melissa Bowers, you are the winner of this session's Q Bank. Okay, again, Melissa Bowers. Congratulations to you, Melissa. We have got your contact information. We will send you an email with the instructions on how you get access to your Q Bank. That Q Bank is going to be over 1,500 practice questions. It also is a $109 value that you get completely for free. You get 30 days access to that Q Bank. Please give us 2 business days at minimum. Okay, 2 business days to get that information to you. Check your spam account to our inbox because sometimes it goes to the wrong spot. We will make sure that we get it to you, though, in at least 2 business days. Congratulations to you. I see that yeah in that chat box. I know we're always excited to get something, especially when we know it's going to be helpful. All right, so guys, thank you so much for tuning in and joining with us for this NCLEX challenge. Do not hesitate to register for any of those other events that we have. We'll be back at 2 p.m. Central Standard Time for one more event. Today, I'm giving away Q Banks all day as long as we've got registered winners. Share this information with your friends. Tell them this information is completely for free. The only thing we need from you is just a registration. That's it. And you join us, give us a little bit of your time, and we will make sure that it's well worth it for you. If you can't join us at 2, we hope to see you in the future. But in the meanwhile, please stay safe, continue to save lives, and best of luck to all of you on the NCLEX. Bye-bye.